Hi, my name is Shikha Regmi Thota. Today I'm going to present Vanisha case. I'm telling you a little bit of background. She is 15 years old female, presented with mother Karen. She has history of cerebral palsy. Normally immobile, confined to bed and uses wheelchair for ambulation. Round the clock assistance and supervision for personal care and activities of daily living. She communicates non-verbally using cues and body language with her mother. Her nutritional requirements are met by feeding from peg tube with continuous feed. She goes to school and has regular chest physiotherapy to clear secretion as she has muscle weakness and unable to clear chest from cerebral palsy. They are also at increased risk of aspiration. Vanessa enjoys playing outdoor and watching video games on YouTube. She also likes the company of her puppy Jax. She is allergic to amoxicillin and latex. She presented with symptoms. She recent deterioration in her general condition. Distressed with increasing severity of spasm, not revealed with her regular meds, which is anticonvulsants and analgesics. Distressed while changing nappies with malodorous stool or urine. Multiple episodes of vomiting associated with EPO. Cues are vitals. Borderline tachycardia with heart rate of 100. It's a compensatory mechanism for dehydration or infection. She is hypotensive with blood pressure of 100/65. It's a sign of dehydration from vomiting, diarrhea, reduced oral intake, causing dehydration. She has temperature of 38.2 degrees centigrade. It's a sign of infection. Raised respiratory rate of 22 per minute is a sign of compensation for dehydration and infection. Molded peripheral skin is a sign of cutaneous hypoperfusion from regional endothelial dysfunction causing patchy discoloration of skin. It's a sign of septic shock and dehydration, predicts mortality and severity of the infection. Her capillary refill time of 3 seconds. Normally it's under 2 seconds. A raised CRT represents hypoperfusion from increased systemic vascular resistance and shunting of capillary blood. An early sign of hypovolemia. I'm gonna explain a little bit of conditions he has. Cerebral palsy. Affected person will have difficulty in controlling and initiating body movements from damage to the part of brain controlling body movements. Usually occurs in childhood. There are 3 types: apastic, dikinetic, and ataxic. In given case, it's more like that Vanessa has spastic type. They are predisposed to infection, mainly chest and urine. They have swallowing difficulties and are unable to clear the chest of secretions. So Vanessa is having chest physiotherapy. Children with CP are at increased risk of seizures and muscle spasm. Anticonvulsant therapy is common in them. So we have list of issues. Identify the source of sepsis or infection and its management. Improve vital signs such as blood pressure, temperature, respiratory rate, and oxygen saturations. Investigate and manage increasing spasm and distress in Vanessa. History is comes on direction. Aim to gather further cues and details from the mother and Vanessa because she is non-verbal. Try to ascertain cause of her distress from body language. Review handover and past medical records to obtain information on past history, risk factors, and similar presentations. Examination. Check person hygiene and mood. Perform primary assessment of airways for secretions. They are likely to increase in chest infection. Inspect breathing. Work of breathing with stridor. It helps to differentiate from upper and lower airways infection. Inspect perineum and nappy for RAS, malodors, stool or urine. Use of accessory muscles, nasal flarings. It represents increased respiratory effort. Examinations. Skin. Clammy-pallor cyanosis. It represents that she has hypoxia. I will perform auscultation of lungs to check for breath, sound equality, right and left, absence of sounds, rhonchi and crackles. Positive signs represents underlying infection. Cardiac auscultation for murmurs and abdominal examinations. Check for tenderness as Vanessa was vomiting and suprapubic tenderness for urinary tract infection. Investigate further to confirm diagnosis. Perform urine dipstick, blood test to check for infection, markers and renal function and dehydration. Imaging of chest for investigation of hypoxia and renal tract for bladder and kidney abnormality. Further systemic clinical assessment as mentioned previously to gather more cues to diagnose source of infection and check for severity of symptoms. And seek urgent help from doctor. And diagnosis. In this case, it looks like urinary tract infection, vomiting secondary to infection causing dehydration, increasing distress and worsening of muscle spasm from infection. From the given information, Vanessa has a malodorous and pain while changing nappies. UTI are common in CP. They are associated with vomiting and decreased oral intake. Dehydration is secondary manifestation from vomiting and sepsis. Decreased peripheral perfusion cause molten skin in peripheries and resulting in tachycardia, hypotension, compensated by respiratory system by increasing the respiratory rate. Low saturation in manifestation of hypoxia from decreased peripheral perfusion. Nursing management. Monitor regular vitals as Venetia is at risk of mid-call. Gain IV access for fluid and medications. Administer fluid as prescribed to improve hydration. Administer oxygen to improve saturation and minimize respiratory effort. Administer paracetamol as prescribed, calculating dose according to age for pyrexia management. Administer analgesic for muscle spasm. Antibiotic as prescribed, being aware of Vanessa's allergy to amoxicillin, which is commonly used drug in UTI. Insertion of catheter in, if recommended, to monitor urine output, to ease of voiding and for fluid balance management. Skin care around the perineum if any sign of rash. Reassure mother to minimize distress. So the reflect is review the effect of intervention by monitoring vitals as and close observation. Example, decrease in temperature, normalize respiratory rate and heart rate, improve in hypotension, anti-skin color change, review effect of analgesia by monitoring her distress and pain scale, repeat blood test to monitor effect and intervention on resolution of infection markers, improved urine output and manifestation of rehydration on fluid balance chart. Thank you very much.